During his time as a senior civil servant, all Fred Ondieki wanted to do was work towards the betterment of his family, his country, and to feel proud that he had achieved his goals in life. Fred would complain of pains on his lower back, muscle cramping, especially on his feet, making him unable to control his walking for a couple of seconds.
Started as a back pain, stiffness, and where sometimes with energy you can bend, not very easily. As you rise, you find it's difficult.
After a series of trips to doctors, Fred's diagnosis shocked not only him, but his entire family as well. Doctors confirmed that he was suffering from spinal stenosis.
92, I was admitted to Aga Khan, not because of the back, but because of blood pressure. And I had the edema on the legs. So physically I was very fit. The heart was very well, even as of today. But the sciatica was compressed. The legs were getting swollen. And the movement was getting more or less restricted. I couldn't walk very fast.
Medically, spinal stenosis is defined as the narrowing of the spinal canal resulting in a lack of space to accommodate the nerves that connect to the skin and muscles of the legs.
The diameter of the spinal canal goes a little bit narrowed down, and that is because it is narrow. There is hardly any space for the spinal cord and the nerve to move freely.
But as a person ages, like in Fred's case, the canal is subject to narrowing, thus causing pinching of the spinal nerves, resulting in clumsiness or neck pain or worse, paralysis to the entire legs.
It is commonly after the age of 40, or say that is the age group 40 to 60, but it starts with that age group because of, I think, mainly it is a degenerative process, your lifestyle and so many other things.
Fred's case was a result of a herniated disc. In this case, the pain will begin in the hip or buttocks and travel down the back of the patient's leg.
Once you know the cause, then you treat the cause. The treatment of the cause is one principle is the pressure should be released, diameter should be increased.
One can either opt for a surgical procedure. Doctors, however, strongly advise against this method of treatment. The other option is to have a non-surgical treatment involving physical therapy, anti-inflammatory medication and steroid injections.
The symptoms are not very bad. Then try to avoid surgery, take rest, some NSAID, that is some drugs. Then you give some physiotherapy, postural exercises, and change up little bit lifestyle. If it is not under control, it is giving you a disability, increasing, the symptoms are disabling. Sometimes you got the neurological pain, neurological weakness and all these things. Then I think surgery is unavoidable.
Fred opted for the latter and has been able to manage the condition. Doctors further advise that people generally need to seek early medical checkups to detect conditions like spinal stenosis, but other bone and ligament conditions early.
So I have not had very serious problems with the condition, but it is a disabling condition. And then many people may have it without knowledge.
As Fred has demonstrated, spinal stenosis is manageable. He may be one of the lucky people who continue to live with the condition getting immobilized. But as the saying goes, prevention is always much better than cure.